Alright, so today we're back to the sharing of the indigestion learning. So it's about TCM syndrome, differentiation of indigestion. Now, for Chinese medicine, okay, so we actually see each condition having different kinds of, we call it syndrome differentiation, okay, that's how we diagnose illnesses. So this is something very unique in Chinese medicine, not found in Western medicine or Ayurveda. Okay, so this is where we see what organs, okay, is out of balance, or what factors that are actually causing the imbalance within the body that is resulting in the condition. Okay, so for indigestion, there are essentially about 5 kinds of syndrome differentiation. Alright, so the 5 kinds of syndrome differentiation, okay, will assist us in knowing which organs is out of balance, and from there we will treat as per the differentiation and the diagnosis. Alright, and then different herbs will be prescribed as well. Okay, and this is highly effective, okay, because through this syndrome differentiation we are able to arrow in which imbalance is there, and usually from there the treatment that is given will then be right on the spot and to the point. Okay, that's why Chinese medicine is very effective in that way. So for indigestion, I'm going to share here 5 syndrome differentiation, and the last 2 I will just elaborate more in my Facebook Livestream group and my Platinum groups. Okay, so the first one is deficiency of the spleen and stomach. So for this, patients will usually feel that their stomach discomfort is relieved after pressing the stomach, and they usually will have accompanying symptoms like feeling their hands and feet are cold, their energy is low, their stools are bad. Alright, then the second syndrome will be dampness, heatiness in the spleen and stomach. So patients will often feel dry mouth and bitter mouth but do not want to drink water, and may also experience symptoms such as nausea, yellow urine and rotten stools. Okay, and then the third syndrome will be mixed syndrome of cold and heat. So patients often feel dry mouth and bitter mouth, a cracking feeling in the stomach accompanied by bowel sounds, and frequent stools without shape. And the fourth one, okay, which I'm not going to elaborate more, but I'll elaborate in my other private groups. So spleen deficiency and stagnation of qi, and then that's the fourth one. And the fifth one will be liver stomach disharmony syndrome. Okay, so this is usually the 5 kinds of syndrome differentiation for indigestion. Okay, so that's it for this week, and then I'm going to talk a little bit in Chinese. Okay， 好，那今天呢，我们会谈关于就是消化不良的症型症状哦。那辨证论治呢，在中医里面是一个很独特的一套方法就是在西医在印度医学里面都找不到的。但它也是因为有这个辨证论治呢，然后我们才可以知道哪个器官呢是不平衡。然后因为它的不平衡呢，然后我们是以正确的治疗方法、治疗穴位、治疗药物，然后就可以很直接、很有效的达到效果。好，那消化不良里面呢，我们通常有5类的症型哦。好，那我在这里会分享那5类症型，前3个我会加以探讨。然后最后2个呢，我会在我的 Facebook Livestream group 还有我的 Platinum group 里面进一步分享。那5个症状症型呢，第一个是脾胃虚寒。那病人经常在按压胃部后会觉得胃部不适，然后得以舒缓。那他们平时都会觉得手脚冰冷、精神不足、大便易较偏稀烂哦。好，那这个是第一个。 就是脾胃虚寒。那第二个呢，就是脾胃湿热。那病人经常觉得口干口苦，但不欲饮水哦。那他们易会出现恶心啊、小便黄啊、大便烂等症状。那第三个呢，就是寒热错杂症。那病人会经常觉得口干口苦，然后胃部有痉挛的感觉，易伴有肠鸣声，大便多不成形哦。好，那以上3个呢，就是这样的症型呢，接下来的2个呢，我只会谈它的症型，我不会加以探讨。那第4个呢，就是脾虚气滞。第5个呢，就是肝胃不和。那其实最后2个呢，是在一般人里面是最常见的，在我们现代人当中也是很常见的那为什么呢？我就会在我的Facebook Livestream Group 还有我的Platinum Group 里面分享咯。好，那这周呢就先谈到这里。那下次呢，我们会进一步探讨关于消化不良的一些进一步的课题。